Hi class, this is Miss Davis and I'm going to lecture on Chapter 46, Antimicrobial Agents. Unfortunately, the PowerPoint slides are not loading. I think maybe because it's 46 slides, I'm not exactly sure, or it's the current weather because it is like pouring down, snowing outside. I don't know exactly what the problem is. However, I have attached under the Lectures tab the PowerPoint slides for you to follow along with this audio lecture. So again, there will be no video or PowerPoint showing on the screen. It's just an audio lecture. So just follow along with your PowerPoint and the slides as I go along, and I'll try to prompt you the best I can. So let's begin. Antimicrobial agents are derived from chemicals that eliminate a living microorganism. They are referred to as antibiotics. These antibiotics are modified and are effective against specific pathogenic organisms. So when we talk about antibiotics, you will learn the different classifications. And again, you are to classify these medications under each category, and you will be able to learn them better and hopefully understand the way they all work. But we will be talking about antibacterial, antifungals, antivirals, antituberculin medications in this chapter. So going to the next slide, antimicrobial agents, as far as antibiotics, are classified according to the type of pathogen that they are effective against. Bacterial agents only work for bacteria. So if you have a virus, antibiotics do not work on viruses. Then you have antifungal, which work for fungal diseases. And you have your own class of antivirals, which are not many as far as like for flu, but antivirals can also consist of the herpes virus, HIV viruses. So when we get to that classification, we'll talk more about that. But the antibiotics are subdivided by chemical family. You have the penicillins, the tetracyclines, the aminoglycosides, just to name a few. When the healthcare provider does order antibiotics, we already have an idea of what the patient has based on their symptoms. If not, the healthcare provider can order what we call a culture and sensitivity, and that is to determine what the pathogen is and the antibiotic agent that will kill that particular pathogen. If the culture identifies the pathogen, then the antibiotics are prescribed. However, most health providers, as myself, we go ahead and prescribe the antibiotics knowingly what their symptoms are, based off what their symptoms are and their history. However, if the antibiotic that is prescribed, it will not kill that particular microorganism, then that's when the culture and sensitivity come in and will alarm us to what antibiotic will kill that particular pathogen. Therefore, that particular agent that was prescribed originally will be DC'd. But for the most part, the selection of antimicrobial agents must be decided on the sensitivity of the pathogen. Now, overuse of antibiotics can lead to MRSA, methicillin-resistant Staph aureus, or VRE, which is another bad community-acquired type of infection. Prophylactic antibiotics are also recommended for patients who are at risk. Not necessarily they have an infection, it's just prophylactic means a preventative type of antibiotic. And those are for your patients who have dental surgeries, or people with endocarditis, which is inflammation of the endocardium of the heart, or just some type of surgery that they may have a cardiac surgery type of procedure done. And of course, as you all know, and if not, if on birth control, you need a secondary type of protection to prevent any unwanted pregnancy when you are on an antibiotic. So as far as nursing assessment before antimicrobial therapy, you basically have to obtain or be aware of their history of current infection, so you need to ask specific questions regarding their body systems, any past history, like ask about any previous conditions, or if they're currently on an antibiotic, or if they've taken a particular antibiotic and it didn't go well with them, which leads to our allergies, any medication allergies, any allergies to dust, food, environment, their medication history, if they're currently taking anything over the counter, prescribed, if they recently received any immunizations, physical examination is where you do a head-to-toe to assess what symptoms they might be having pertaining to that particular pathogen. Any laboratory diagnostic testing, such as a CBC, which would assess for any infection or inflammation, such as a SUD rate. C-reactive protein level will also detect some inflammation, or a chest x-ray or a TB test would determine what type of pathogen they might have. And you need to identify the patients who need that prophylactic antibiotic, like I mentioned before, your dental surgeries, endocarditis, people with heart problems. So as we proceed to the next slide, in the nursing assessment during antimicrobial therapy, you need to assess for nausea and vomiting as well as diarrhea. There are the big three, which is determine if it's related to an antibiotic, meaning if they need an antibiotic, determine their hydration status, and of course report any diarrhea or abdominal pain. With nausea, vomiting, and diarrhea, these are big adverse effects that are common with antibiotics. And you need to ask your patients, do they have a history of this prior? How soon after starting the antibiotic did these symptoms start? Since the antibiotic, has your diet changed, or have you traveled out of the country recently? Were they taking other medications, such as prescription or over-the-counter? How much fluid has been consumed, because decreased fluid intake can lead to gastritis. If they have any diarrhea, what does it look like, their frequency, is it like 3 or 4 times a day, 5 times a day, the color of the stool, and especially any type of abdominal pain. So secondary infection consists of oral infections, lesions, or itching in the vaginal or anal areas. And this occurs with administering antibiotics because of the broad spectrum antibiotics that can be initiated over an extended period of time. And so, secondary infections consist of those yeast infections, after taking antibiotics, like what some women do get. But some people also get oral infections, and you would need to look for black hairy tongue, cold sores, thrush, which is another form of yeast in the mouth, itching to the vagina and anal areas. And if they have any diarrhea due to secondary infections result basically because the normal flora are eliminated, our normal bacteria in our bodies, which causes the organisms to multiply despite being on an antibiotic. So allergies, so the next slide consists of allergies and anaphylaxis, and these can be mild to fatal within 30 minutes after administration to days after therapy with an antibiotic. Anaphylaxis can occur, especially if they're allergic. They can have laryngeal edema, shock, dyspnea, as well as skin reactions such as a rash. Facial edema is a common one, dyspnea, and even low blood pressure. So you need to determine if the allergy, such as the skin edema or dyspnea or GI symptoms, is a true allergy to that particular medication. And it is a true allergy to that medication if it's accompanied by the skin rash, the facial edema, the dyspnea, as well as the low blood pressure. So with the next slide, the nephrotoxicity, you will need to assess the BUN and creatinine. You will see an increased BUN and creatinine possibly, a decreased urine output. You need to assess for their changes in their urinalysis, if they have CAS, protein, blood in the urine, etc. Because some antibiotics are considered nephrotoxic, such as your aminoglycosides, tetracyclines, and vancomycin. And we'll get to those particular classifications here shortly. So the nephrotoxicity is kidney toxicity. The next one is hepatotoxicity, which is liver toxicity. You need to assess for any pre-existing hepatic disease, such as hepatitis, cirrhosis. Review their ALT and AST, which are their liver enzyme functions, along with their PT, proton, which can also be elevated, and report any abnormal findings to the healthcare provider. Meds that are hepatotoxic are your rifampin, your isoniazides or INH, and your sulfonamides. Signs and symptoms to report if they're hepatotoxic are anorexia, nausea, vomiting, jaundice, hepatomegaly, which means enlarged liver, as well as splenomegaly, which is enlarged spleen. Some antibiotics can also cause what we call ototoxicity, which is damage to the 8th cranial nerve, especially with the aminoglycoside antibiotics, which are your streptomycin, gentamicin, tobramycin. And it affects that 8th cranial nerve, which can lead to hearing loss. So some of the symptoms the patients may complain of are dizziness, tinnitus, which is ringing in the ears, as well as unable to hear. Blood dyscrasias, you need to assess for those when your patients are on antibiotics. Any blood disorders such as anemia, folic or B12 deficiencies, or if they've received chemo, radiation, or a transplant, especially with your immunocompromised patients, such as your cancer or HIV patients, can lead to blood dyscrasias. You need to assess if they're taking Epigen or Neupogen. That's to help with their white blood cell count. Any bleeding disorders or thrombocytopenia, which are low platelets. And if they do have thrombocytopenia, you need to get an order to give vitamin K, which helps stop the bleeding. You need to also observe for bleeding gums or bleeding at the incision site, petechiae, epistaxis, which is nosebleeds due to the low platelets. And if they do have low platelets, they may tell you that they're experiencing symptoms of a sore throat, fatigue, increased temperature, bruises on the skin, which may also be signs of bone marrow suppression. You need to also assess for photosensitivity to some of these antibiotics. Some antibiotics cause photosensitivity, so you need to assess them for sunburn, itchiness, rash, urticaria, which is also hives, pruritus is itching, especially after being exposed to sunlight. Those are signs and symptoms of photosensitivity, because some antibiotics recommend that you're not in the sun. So you need to teach them to avoid the sunlight, any tanning beds, wear long sleeves when they're out in the sun, wear a hat, wear sunglasses, and sunscreen when exposed to the sunlight. So next slide is the implementations. They need to take precautions for any infection transmission. They need to monitor phlebitis if they're getting an antibiotic through the IV. They need to administer an established time schedule. Some antibiotics are ordered morning and night, twice a day. So you need to educate them on that. Determine whether they're able to eat it with food or if they can take it on an empty stomach. And of course, they need to identify if they have any drug allergies. So with nausea, vomiting, and diarrhea as your nursing interventions, you need to give with food if possible, or the healthcare provider can switch to some sort of parenteral medication. With secondary infections, you need to notify the healthcare provider if that develops, such as your yeast infection, thrush, so they can prescribe you the proper medication to take care of that. Any allergies and anaphylaxis with these antibiotics, you need to monitor patients with allergies, such as asthma, rhinitis, or taking multiple allergic medications. You need to watch carefully for 20 to 30 minutes after the administration. As far as other nursing interventions with nephrotoxicity, again, monitor the BU and the creatinine, the INO, report any declining urine output of less than 30 cc's an hour, which I told you before is referred to as oliguria. You need to watch for hepatotoxicity and by monitoring the labs, the AST, the ALT, as well as the PT, observe for anorexia, nausea and vomiting, and jaundice. With ototoxicity, you need to report any hearing impairment, dizziness, or tinnitus due to that acranial nerve possibly being damaged. Again, especially with aminoglycoside antibiotics. Any blood dyscrasias, monitor and report any sore throat, fatigue, elevated temperatures, skin hemorrhages, and bruising. Can lead to bleeding disorders. And photosensitivity, wear sunscreen, avoid ultraviolet light, especially when you're on the tetracycline. Those you should avoid the sun with that. As far as teaching your patient when they're on these antibiotics, they need to have rest, nutrition, and hydration, prevent infection, promote good hygiene, refrain from any sexual intercourse during therapies for any STDs, because again, antibiotics decrease the effects of birth control, especially if you're on that. Common adverse effects of these antibiotics you need to be aware of and what you report to the healthcare provider in case they do develop side effects to these medications. And of course, you want to educate your patient to take the entire course of antibiotics to prevent any microbial resistance to the antibiotics, and do not stop until the whole antibiotic that was prescribed has been completed. So now let's talk about different drug classifications for these antimicrobial agents. The first class are aminoglycosides. Those are your gentamicin, streptomycin, and tobramycin. The action of these aminoglycosides is to kill bacteria by inhibiting their protein synthesis. This can be given by PO or IV. It's effective against gram-negative organisms that cause urinary infections, meningitis, wound infections, and septicemia. These particular type of microorganisms are your Enterobacter, your E. coli, your Klebsiella, your Pseudomonas, Klebsiella, Salmonella, or Shigella. So aminoglycosides can treat all those. Again, the severe adverse effect for aminoglycosides is that ototoxicity, damage to the acranial nerve, where they have dizziness and tinnitus and hearing loss. And a big thing with aminoglycosides is nephrotoxicity. It's very toxic to the kidneys. Most antibiotics are compatible with heparin. However, gentamicin is one antibiotic that's not compatible with heparin, so it's basically incompatible. The next drug class are the carbapenems, the Promaxin, and Invans. Those inhibit bacterial cell wall synthesis. Okay, so it prevents the bacteria from entering the cell wall to multiply. It's a potent broad-spectrum agent resistant to beta-lactamase enzymes secreted by the bacteria. So it prevents the bacteria from secreting those into the cells. So carbapenems are normally IV and IM only, so you would only see those given in the hospital through IV piggyback or an IM shot. It's to treat severe infections by multi-resistant organisms, such as your Pseudomonas, Staph aureus, E. coli, and Klebsiella. Again, these antibiotics are only given IV or IM. The major side effects with this is you will see patients with severe diarrhea possibly complain of some abdominal pain, because it can cause pseudomembranous colitis. So you need to make sure that the patient does not have any blood or any mucus in their diarrhea, because if they do, that's an adverse effect to the carbapenems. They also may complain of dizziness, confusion, as well as seizures. And so the patients on carbapenems, the Promaxin and Invans, you need to implement seizure precautions and make sure they are taking their seizure medication to prevent any seizure exacerbation. The next drug class are your cephalosporins. This is Seclor, Omnicef, Vantin, Cefzal, or Cefin, Keflex. These do have a cross-sensitivity to penicillin. I say they are a sister to penicillin, so if you're allergic to penicillin, you're kind of allergic basically to cephalosporins. That's why it's considered a cross-sensitivity to penicillin. So if you can't take penicillin, you can't take cephalosporins. They are broken down into first generation and second generation cephalosporins. The first generation cephalosporins affect gram-positive organisms such as your Staph aureus and strep. Those first generations treat those particular organisms, and your second generation affects the gram-negative organisms such as your E. coli. So how this works is cephalosporins inhibit, again, bacterial cell wall synthesis, prevent the bacteria from entering further cells. It's used to treat urinary respiratory tract infections, abdominal infections, bacteremia, meningitis, as well as osteomyelitis. But see, antibiotics have more than just one use. So common adverse effects, again, diarrhea is a common thing with cephalosporins, which alters the normal flow of the GI tract. So monitor for signs of dehydration when they have diarrhea on this antibiotic. They can also have adverse effects of electrolyte imbalance. So you need to watch for hyperkalemia, increased potassium, and hypernatremia, which is increased sodium. And you need to watch those levels because these particular antibiotics can have high electrolyte content. So those are the common adverse effects. The serious adverse effects, again, are secondary infections with cephalosporins. So you need to alert your physician if they do develop thrush or yeast infections so they can prescribe something to take care of that. Again, this is cephalosporins are hepatotoxic as well as nephrotoxicity, and they can also have hypoprothrombonemia, which is that low platelet count. Basically, hypoprothrombonemia is a rare occurrence and can occur with or without bleeding, but continue to monitor for bleeding signs and any nosebleeds when on these cephalosporins. So if a patient is receiving a cephalosporin, aminoglycosides, vancomycin, as well as loop diuretics should be assessed for signs of nephrotoxicity. The next class of antibiotics are your glycocyclines, such as tigecycline, which is Tigecyl, clinically related to tetracycline. However, its bacteriostatic effect works against broad-spectrum gram-positive and gram-negative and anaerobic organisms. So what Tigecyl is mainly IV. It's not prescribed PO. It binds to the 3-OS ribosome, preventing protein synthesis, and therefore these are not bactericidal, which kills the organisms. They are bacteriostatic, which stops the bacteria from reproducing, which inhibits the growth and reproduction of bacteria. So the uses is it treats broad spectrum gram-positive and gram-negative, as well as anaerobic infections. So you see these mainly in your skin-to-skin structure infections caused by E. coli, Staph aureus. Those are Tigecyl is pretty susceptible to these organisms, especially if they're intra-abdominal infections. You do not want to use Tigecyl for patients less than 18 years old. It may cause enamel hypoplasia, in which it's permanent yellow or staining and brown staining of the teeth, because it's similar to the tetracycline family. So common adverse effects to Tigecyl glycocyclines is gastric irritation. You have nausea and vomiting, and usually mild to moderate, at least the first to second day of therapy. Serious adverse effects are severe diarrhea. At greater than 5 stools, you need to report immediately to the healthcare provider, or they may be developing pseudomembranous colitis, especially if there's blood and mucus in the stools. Tigesil is also known to have photosensitivity, so you need to avoid any exposure to the sunlight, and tell them to wear hats or sunscreen, etc. The next class of antibiotics are macrolides. You've all probably heard this before, received it at one time or another. This is your azithromycin, also known as Zithromax or Z-Pak, erythromycin or emycin, and clarithromycin or Viaxin. These are all macrolide antibiotics. They inhibit protein synthesis. They are bacteriostatic as well as bactericidal, depending on the organism. So macrolides treat respiratory, GI, skin, and soft tissue infections, along with some STDs, especially when the penicillin, cephalosporins, and tetracyclines cannot be used. So therefore, a common side effect is GI irritation, such as nausea, vomiting, or diarrhea, or an abnormal taste in the mouth. It's usually mild and will resolve after further use of the antibiotic. Serious adverse effects, again, your severe diarrhea, and it could also cause thrombophlebitis, especially with erythromycin IV. So you need to always observe, investigate any pain at the site of the IV, report any redness and edema at the site, and test for Homan signs, which is the dorsiflexion of the foot that you learned in physical assessment, where pain is caused when the foot is dorsiflexed. That can also lead to thrombophlebitis. The next class is the oxazolidinones, also known as linezolid, which is Zyvox. This can be given topical, PO, or IV. Again, it inhibits protein synthesis in bacterial cells. This is considered bactericidal as well as bacteriostatic. And it's used for uncomplicated and complicated skin infections, commonly used for community-acquired pneumonia or strep pneumonia. They treat serious or life-threatening infections caused by gram-positive organisms, such as your vancomycin-resistant bacteria or your MRSA. So common adverse effects, again, gastric irritation can be mild to moderate. They can also experience some headaches when on Zyvox. Severe adverse reactions are your diarrhea, bone marrow suppression, where you can have bone marrow suppression symptoms include fatigue, increased temperature, bruises on the skin, and petechiae. So you need to report those immediately to the healthcare provider if the patient is on Zyvox experiencing these symptoms, because it can lead to bone marrow suppression. Secondary infections, again, Zyvox can cause that, as well as lactic acidosis, where recurrent nausea and vomiting and unexplained acidosis occurs, and you will also see low bicarb levels. Seizures can also occur with Zyvox, as well as visual neuropathy, where you have blurred vision to the loss of an eye, especially with treatment greater than 28 days, if they're on this for 28 days, and it should be reported to the healthcare provider for further evaluation. The next classification are penicillins, and these are the first true antibiotics ever, and these are the most widely used and widely ordered. These are your amoxicillin, and notice they all end in cillin. Ampicillin. Augmentin is a antibiotic that contains amoxicillin as well as beta-lactamase, which helps kill microorganisms. Unicin, Zosyn are all penicillin classification. But it inhibits cell wall synthesis You have your penicillinase-resistant penicillins, most effective against bacteria that multiply rapidly. You use penicillins to treat middle ear infections, pneumonia, meningitis, UTI, syphilis, and gonorrhea. It's not used as a prophylactic antibiotic before surgery or dental procedures because it can cause rheumatic fever. Common adverse effects with penicillin family is diarrhea or an electrolyte imbalance where you will see hyperkalemia or hypernatremia, high potassium, high sodium. Severe adverse effects of penicillins are hepatotoxicity as well as nephrotoxicity. When a penicillin is given with preventative, especially if the patient does have an STD, the purpose of the preventative allows the penicillin to remain in the body a lot longer, which enhances the drug. So preventative does inhibit the excretion of penicillin so that it can last longer in the body and enhance the drug of penicillin. The next classification are your quinolones, such as your ciprofloxacin. These all end in floxacin. Ciprofloxacin is your Cipro, levofloxacin is your Levaquin, and moxofloxacin is your Avalox. The quinolones are a subclass known as the fluoroquinolones and prevents activity of the DNA gyrase, an enzyme needed for replication of bacteria. So basically, these help prevent bacteria from replicating. So they're bacteriostatic. The use is effective against gram-positive and gram-negative bacteria, such as Legionella, Haemophilus influenza, and your methicillin-resistant staph. Sinusitis, bronchitis, community-acquired pneumonia, skin and soft tissue infections, and acute pyelonephritis is where you may see the fluoroquinolone antibiotics ordered for these patients. So you need to also watch with fluoroquinolone for a prolonged QT interval in the elderly, which is when they do an EKG of your heart, because it can cause life-threatening dysrhythmias when you're on a fluoroquinolone. You should not be given fluoroquinolones to patients who are less than 18 years old because it can lead to increased musculoskeletal disorders, such as arthralgia, gait abnormalities. The next class is streptogramins, which is your Sinersen. Action is to inhibit protein synthesis in the bacterial cells. It treats VRE as well as MRSA. These are given IV, and they are monitored at home through home health if the patient is sent home with this particular antibiotic, and it is given IV only. Another drug class is your sulfonamides. This is your Trimethoprim-Sulfamethoxazole, also known as Bactrim. And with sulfonamide being an ingredient to this particular medication, you do not want to give to patients with a sulfur allergy. But again, the action of sulfonamides is to inhibit bacterial biosynthesis of folic acid, resulting in cell death. So it kills that cell that contains that bacteria. It's used to treat UTIs as well as otitis media, which is an ear infection. May be used to prevent strep infection or rheumatic fever, especially in those patients who are allergic to penicillin. Both are also used to treat traveler's diarrhea, acute COPD in adults, and prophylactic treatment of pneumocystic cardiac pneumonia, which you see in your immunocompromised patients, such as your HIV patients. The common adverse effects of sulfonamides are nausea, vomiting, anorexia, and diarrhea. Serious adverse effects are rash, pruritus, photosensitivity, hematologic reactions, and neurologic CNS effects such as headaches, dizziness, confusion, as well as drowsiness. So the next class are your tetracyclines. These consist of your doxycycline, minocycline, tetracycline. It inhibits protein synthesis by the bacterial cells. It's used for gram-negative and gram-positive bacteria. It treats venereal diseases, UTIs, upper respiratory infections, pneumonia, meningitis, when penicillin is contraindicated. Tetracyclines help with acne, rickettsia, which is tick bite or Lyme disease, and as well as any mycoplasma infection. You do not give to children less than 18 years old because tetracyclines cause gum hyperplasia, which involves permanent yellow and brown staining of the teeth. With tetracyclines, it must be administered at least 1 hour before or 2 hours after meals. Do not ingest any antacids or ampho-gel, which is aluminum hydroxide, when taking tetracyclines, or any milk of magnesia or any other dairy products containing calcium, aluminum, magnesium, or iron. Adverse effects of tetracyclines: nausea and vomiting, anorexia, abdominal pain, and diarrhea. Severe adverse effects of tetracycline, like I said, is photosensitivity, so stay away from sunlight. So that concludes your antimicrobial or antibiotic agents. So let's talk about next your anti-tuberculin agents. These are the common ones you use to treat TB. The first class is ethambutol, which is iambutol. The action is to alter cellular RNA synthesis and phosphate metabolism. It's used to treat TB, used in combination with other antimicrobial agents to prevent resistance of organisms. Common adverse effects of ethambutol are nausea and vomiting, anorexia, and abdominal cramps. Serious adverse effects are confusion, hallucination, blurred vision, as well as red to green vision changes. So you need to monitor for that. The next anti-tuberculin drug is isoniazid, also known as INH, also known as Nidrazid. This is the mainstay or corner treatment for the prophylaxis of the treatment of TB, tuberculosis. It disrupts the cell wall synthesis and inhibits replication of the tuberculous bacteria. So used to treat TB, especially with combination with other tuberculin drugs, and you may see ethambutol and INH ordered together, which is fine. Common adverse effects for INH or isoniazid is your nausea and vomiting. Severe adverse effects are your hepatotoxicity, tingling, numbness of the hands and feet, dizziness, as well as ataxia. The next anti-tuberculin agent is rifampin. This is Rifidin. Action is to prevent RNA synthesis by inhibiting DNA-dependent RNA polymerase. So basically it helps to treat TB bacteria. It eliminates Aminoglycoside and Haemophilus influenza type B, as well as the HIV infection from asymptomatic carriers. Common adverse effects are reddish-orange secretions, and severe adverse effects are nausea, vomiting, anorexia, and abdominal cramps. So when they refer to miscellaneous antibiotics, those are your Zactam, which inhibits cell wall synthesis, your chloramphenicol, which inhibits bacterial protein synthesis, your clindamycin, also known as Cleocin, Dalacin C, inhibits protein synthesis, basically treating MRSA and other skin-to-skin infections. And then daptomycin, also known as Cubicin, are used if resistant to penicillin, cephalosporins, or vancomycin. The next slide of miscellaneous antibiotics is your metronidazole, which is Flagyl, used to treat trichomonas as well as bacterial vaginosis, BV, or any type of protozoal, illness. Then you have spectinomycin or tobercin, used for gonorrhea. Tindazole, Tindamax, is also another miscellaneous antibiotic, as well as vancomycin, which prevents synthesis of bacterial cell walls, and it's used to treat MRSA, MRSA. Now, vancomycin is very nephrotoxic, as well as ototoxicity can occur when taking vancomycin. So let's talk about topical antifungal agents. These alter permeability of cell membranes, causing amino acids and electrolytes to leak out. Uses to treat tinea pedis, which is fungus of the foot, tinea cruris, which is jock itch, tinea corporis, which is a yeast infection throughout the body, along with tinea versicolor, which means the same thing, fungal infection throughout the body, as well as any other candida infections, such as in your vagina from antibiotics or thrush. Common serious and adverse effects are irritation, redness, swelling, blistering, as well as oozing. With antifungal medications, you always need to monitor their liver function tests, the AST, the ALT, and PT. So the antifungal agent that you might be familiar with is fluconazole, which is diflucan. It's chemically resistant to ketoconazole and itraconazole because it inhibits certain metabolic pathways in the fungi. The uses are to treat meningitis, candida, systemic infection. Common adverse effects are nausea, vomiting, diarrhea, severe adverse effects of rash, and hepatotoxicity. The next class is your Greazo-Sullivan microcide. The action is to stop cell division and new cell growth. Greazo-Sullivan treats ringworm of the scalp, body, nails, as well as feet. Common adverse effects are your nausea, vomiting, and abdominal cramps. Serious adverse effects are your urticaria, which is hives, rash, pruritus, photosensitivity, confusion, dizziness, secondary infections, and disclassification of antifungal agents are nephrotoxic as well as hepatotoxicity, and therefore need to monitor the BUN, creatinine, and AST, ALT, as well as your PT, proton. Another antifungal is itraconazole or Sporanox. Again, chemically related to fluconazole and ketoconazole. It's used to treat a variety of infections such as candida, histoplasmosis, blastomycosis, which can occur in the lung. Common adverse effects are nausea and vomiting. Serious adverse effects, again, affects the liver, hepatotoxicity, heart failure, pruritus, as well as rash. Another antifungal is your ketoconazole, used to treat candida, histoplasmosis, topically treat seborrheic dermatitis, which is the flakiness of the skin. Common adverse effects are your nausea and vomiting. Serious adverse effects are hepatotoxicity and pruritus, as well as rash. Another antifungal medication that I prescribe practically a lot is terbinafine or Lamisil. It's to treat onychomycosis of the toenail or fingernail, which is basically a fungal infection underneath the nail bed. So severe adverse effects are pruritus, rash, fever, chills, nephrotoxicity, hepatotoxicity, neutropenia, as well as lymphopenia, low white blood cells. So now let's talk about antiviral agents. The drug acyclovir or Zilbrax is used to treat herpes genitalis, orally used to treat recurrent genital herpes, IV is to treat herpes simplex 1 and 2 in immunosuppressed patients. Serious adverse effects are pruritus, rash, burning, hive, evaporasis, nephrotoxicity, hypotension, as well as confusion. Another drug that's antiviral is fanciclovir or Fanvir. It's a prodrug of penicillin, which inhibits viral cell replication. It's used to treat recurrent infections of genital herpes or acute herpes zoster. And common adverse effects are nausea, vomiting, and headache, Herpes zoster is actually shingles, just to let you know that. Serious adverse effects are confusion when taken Fanber. Next is, the next antiviral is ribavirin, also known as Virazole, Ribepil, Ribosphere. The action is actually unknown, but the usage is to treat RSV in infants as an aerosol, plus treatment of chronic hepatitis C. So in combination with interferon alpha-2b2 treat chronic hepatitis is effective against DNA-type viral families. The common adverse effects are rash, conjunctivitis, as well as diminishing pulmonary function and anemia. And the last class of antiviral agents are Relenza, or let's talk about Tamiflu, also known as oseltamivir. Basically, with Tamiflu, it reduces symptoms caused by the flu virus and secondary to infections such as pneumonia, and it must be given within 48 hours after you develop symptoms. After symptoms have started, because you cannot start after 48 hours Tamiflu. But the goal is to reduce the symptoms of the flu. So again, do not give him flu, which probably won't be prescribed by the doctors if it's more than 48 hours. So that pretty much ends the Chapter 46 Antimicrobial chapter. And if you have any questions regarding this audio lecture that you want answered, please feel free to email me or text me. Have a good night.